what we call the septum of the heart, and this is the area where we're going from the right side of the heart to the left side of the heart. And on the bottom here are two pulmonary veins, both the left superior pulmonary vein and the left inferior pulmonary vein.
That you showed us on the model just a few minutes ago.
Exactly.
Right. Lots of technology there, lots of screens to keep up with. Are you monitoring the arrhythmia? Might there be an arrhythmia during this procedure?
Absolutely. The patient's monitored both internally and externally. So you can see here in this picture there's actually a catheter in the lower right-hand portion of the image, and that has 10 different electrical poles on it, and we're able to record electrical activity inside of the heart with that. But also we're always monitoring the external rhythm as well. And anytime you have catheters in the heart, you can induce heart rhythm problems or a fast heart rate. So they have to be monitored at all times just to make sure that they're not in a rhythm that's dangerous.
Right. And the dark areas, I'm sure we'll see again on the fluoroscopy, the dark squares, if you will, those were the areas that were regulating the impulses?
There were a series of 10 dark squares.
Yes.
That's right. That's
we'll see that again in just a minute. All right. Dr. Savello, that is
what we call a Brockenbrough needle. And this needle is a very long needle that's inserted through a long sheath.
Sure is. Wow.
And this needle allows us to obtain access from the right side of the heart to the left side of the heart. There's a septum that separates the right side of the heart from the left side of the heart. And in order to get to where the pulmonary veins are located, which is on the left side of the heart, we have to puncture through that septum.
I think if you point out here on the screen, that's what we're doing right now.
So here we're advancing this long sheath, which you see on your screen, and we're threading the needle through this. And in a moment you'll see an echo image, which we see here, which is actually the needle starting to be punctured through. There it goes right there. The needle went through that septum, and now that needle is on the left side of the heart.
If you notice those bubbles, that indicates that we're on the left side of the heart.
Okay. So
that large dark space there is the left atrium.
Will this patient experience any pain? I mean, watching this, it looks a little scary. I'm sure, not that we doubt anything about what you're doing, but would the patient experience any pain in the areas in which you placed the catheter? Might it just be the groin areas where you made the incisions? Afterwards, not
as far as discomfort?
Yes.
You know, normally that's the only discomfort they have, and the majority of the time they don't have any discomfort down there. Those access points are relatively small, and there's not very much discomfort associated with that. Sometimes after the procedure they may have some chest discomfort and some palpitations, because anytime you ablate inside the heart, you do irritate the heart a little bit. Again, majority of patients don't even experience a lot of that. So really, once the procedure's done, there's very little discomfort.
That's amazing. I know we have an animation that we were going to show folks, something that you might show a potential patient, a potential candidate for this procedure.
This basically just shows you, we were mentioning that we use the needle and the catheter to get access from the right side of the heart to the left side of the heart. And this animation, if you can roll it, will show you exactly, we're dragging the catheter down, and there's a needle that's punctured out, and then we're able to pass our needle through the septum and onto the left side of the heart. And this is a very crucial part of the procedure. For a very long time, to be able to ablate arrhythmias from the left side of the heart was very difficult, because we did not really have a safe way to get from the right side of the heart to the left side of the heart. So
this represents an advancement then.
It's definitely an advancement. And what makes this procedure safe is the fact that we are using that echo that we mentioned. Yes. The fact that we can actually see that we're in the right position in the heart, that when that needle comes out, that needle is coming out where it should come out, and not coming out where obviously it shouldn't, which can result in a lot of complications. So it definitely makes the procedure a lot safer. You know, I would say still to this day, not everyone uses the intracardiac echo technology, but it is something that we both feel is crucial to the procedure.
Let's take another question from one of our internet viewers. Is atrial fibrillation ablation the procedure that was used on me as I was diagnosed with Wolff-Parkinson-White syndrome approximately in 1992, and my condition was repaired with ablation?
Sure. There are several different types of arrhythmias that people have. Atrial fibrillation is one of those arrhythmias. People with Wolff-Parkinson-White can have atrial fibrillation, but they also have another rhythm, which we call AV reentrant tachycardia. And so more than likely what she had was an ablation of an extra pathway in our heart, more so than an atrial fibrillation ablation. Patients with Wolff-Parkinson-White are are at a higher probability of having atrial fibrillation. But once that ablation for their Wolff-Parkinson-White is performed, they're less likely to have atrial fibrillation.
Let's take another question before we go back to some more video. This one from a parent who says, my 5-year-old son is experiencing very fast heartbeats occasionally, especially when running or playing. He just sits down and I can even hear his heartbeat. It is so fast. It lasts up to 5 minutes and goes away. Might this be AFib?
In a 5-year-old, it's unlikely that it's atrial fibrillation, but certainly it could be a different type of arrhythmia, like the patient we just discussed with Wolff-Parkinson-White. You can have other rhythm problems that aren't atrial fibrillation, so certainly a 5-year-old with those kind of symptoms should see a cardiologist and be evaluated by a pediatric cardiologist.
Absolutely. Why don't we resume looking at our video of the surgery, and as we do, I'd like to just point out that one of the things I've learned about the experience that you guys have here at the lake is that you do have such extensive experience in doing the atrial fibrillation ablation that you're able to do maybe more extensive ablations, a higher success rate, a really good patient outcome.
Mm-hmm. Yeah, certainly these procedures are operator dependent. There's a lot of technology, as you see. There's a lot of experience with that technology that during the more procedures you do, the overall better your chances of success.
Let's take a look here again, the fluoroscopy.
Yeah, so what we're seeing there was we're advancing our sheath into the left atrium, and what we're about to introduce is what's called a circular mapping catheter, otherwise known as a lasso catheter. And what this catheter has is it has 10 electrodes around it, and these electrodes measure the potentials inside of those pulmonary veins we were speaking about. So we're going to take this catheter, advance it through our long sheath.
It collapses to be able to fit through the sheath?
It collapses, and then you'll see once it comes out, you'll see it will actually pop out and then look like a lasso, certainly just like a lasso you would use to lasso a cow.
Yeah. Doctor, what is this in the lower right-hand quadrant of the screen? It looks like a stethoscope almost there.
That is an electrode that is on the outside of the body, which is used to monitor the patient's heart rate during the procedure.
We should point out the other electrodes there are pacemaking wires that the patient already had in.
So the patient does have a pacemaker?
That's a permanent pacemaker.
A permanent pacemaker. All right, what are we looking at here?
So what we're looking at here is actually the intracardiac echo images of the heart. And what our nurse is drawing is the left inferior pulmonary vein. And what she's creating is a three-dimensional map from a two-dimensional image. So both fluoroscopy and echocardiography are both two dimensions. But by taking different planes in the heart, we're able to reconstruct a three-dimensional image.
What she's doing during this procedure.
What she's doing during this procedure. So what you see in gray is the three-dimensional image that we made using the intracardiac echo. We then take that image, and what she's doing right now is we take a CAT scan image that had been performed several days prior to the procedure, and we merge those two images together, which then gives us a real live version of what the heart looks like inside. And it allows us to actually act as if we're inside of the heart looking at these pulmonary veins. So it certainly helps with knowing where you are inside the heart.
What are the blue areas that we're looking at right there?
The blue areas are actually the CAT scan that had been performed several days before.
There it is again.
There it is again, yeah.
Okay.
And so that's what that image is there.
They're just trying to merge the technology. So by merging them, we get a much better and more accurate view of what the left atrium looks like. So it allows us to navigate around the left atrium with much greater ease.
How many people are in the OR or in the lab for this procedure?
It depends on the case. Sometimes Dr. Savell and I will both be in there, and then there'll be two nurses usually, and then a monitor. And then there's also a technician from the company that runs the 3D mapping technology who helps us create the map. So usually 5 to 6 people.
Yeah, definitely a team. Let's take another question from a viewer. What % of patients are in normal rhythm 1 year after the procedure, after 5 years?
Yeah. So that number depends on whether or not you have paroxysmal atrial fibrillation, like we spoke of, that you're in or out of atrial fibrillation, or you have persistent atrial fibrillation. So it's hard to say in that viewer's instant what the success rate should be. But for paroxysmal atrial fibrillation,